Welcome, Jim, Dara, and Brandon. We're here together today to talk about what happened at the very end of the 2015 legislative session, an end, Dara, that came a lot earlier than a lot of people expected and surprised a lot of people. So what happened?
It did surprise a lot of people. A lot of long-term veteran lobbyists were totally shocked at the shutdown by House Speaker Crisafulli on Tuesday around 1 o'clock.
When did he start and his lieutenants start thinking about doing it then rather than later in the week?
Sure, there had been rumors for a while, and there was the buzz on the fourth floor was, oh, they're going to shut down on Thursday, oh, they're going to shut down on Wednesday, or they're going home. And you know, we all, those of us who think that we know everything, thought, oh no, they'll never go home, you know, more than a day or more than a couple hours early. So we were all taken aback by it. But what House Rules Chairman Rich Workman told me, that the speaker started to get really irritated. That he described it as the nail started going into the coffin when the House made an offer, a budget offer, that dealing with LIP, and we'll talk about that later, and not dealing with Medicaid expansion. And the Senate came back. The Senate response to that was, you know, no thank you, we want our Medicaid expansion, and we're sticking by our original plan. And then over the course of the next few days, that would be Friday and Monday, the Senate was sending bills back that were non-controversial bills, but they were mending them and putting many things onto the bills that they had thought they had agreed to that had nothing to do with the budget. And so what Representative Workman told me was that on Tuesday morning that they had a conversation, that he and Speaker Crisafulli had a conversation over coffee, and they started doing what ifs. And the what ifs were, you know, they said, you know, we've done everything that we can do policy-wise, and the only thing that's left is the budget, and we know we're not going to resolve the budget until we come back for a special session. So I might as well let these guys go home and get some time with their families and rest up and not waste any more time. So I think that was really sort of the straw that broke the camel's back, was the fight over the bills.
Brandon, Jim, did either of you, do you have anything to add to the nuances of this? Because this was a big deal. It caused a big explosion. Either one of you?
Well, it not only did it catch a lot of the lobbyists off guard, it caught the Senate off guard. Senate leaders were already trying to figure out how to bring the session in for a landing, even minus the budget. The Senate President, Andy Gardner, had offered to send over a couple of his lieutenants to the House to start negotiating on that. When Speaker Crisafulli finally decided to pull the plug on the session, he called Andy Gardner on his cell phone, could not reach him, and so he left a voicemail. And what I found out is that Andy Gardner ended up watching the House adjourn on a television in his press secretary's office. And that was sort of the first inkling he got that the whole session had gone off the rails. It caught the Senate off guard as well as everybody else.
Well, the Senate was in the middle of a debate on fracking, this controversial issue about fracking, and everybody started sputtering and running around the Senate chambers because all of a sudden all this stuff was happening down the hall, and it appeared to catch them by surprise, and the fracking bill wound up dying, and you know, anyway, it was kind of a bizarre scene to watch.
I have a friend, unfortunately he's passed, God rest his soul, who said that a secret in Tallahassee is something you tell one person at a time. And how did this happen, Dara? I mean, this was, it was a well-kept secret.
It was a well-kept secret, but I don't think that the speaker, I think one of the reasons it was so well-kept is because the speaker didn't decide on Friday to gavel down on Tuesday. I think that it was building, there was talk about going home early, but I think that decision was made that morning. It has been so acrimonious, and I heard privately that, you know, the speaker was complaining at the way that the president was characterizing their relationship, that he was trying to reach out to Andy Gardner, and what, in the words of Rich Workman, radio silence. from the Senate president. So there was a lot of finger pointing, a lot of hard feelings. I don't know that it was impulsive, but it was sort of, and let's face it, I mean, a lot of times in the last couple of days, one chamber is just sort of sitting around waiting for stuff to come over for the other chamber. So that's not all that unusual for them to not have too much to do.
Was then the message that he was getting through the various techniques simply that nothing's going to happen until you give on Medicaid? Is that kind of what you think he was feeling? And so he's saying, we're not going to give on Medicaid, so shut it down.
It's a standoff.
Okay.
Right.
That's a standoff. Well, Brandon, standoff, impasse, shootout at the OK Corral, whatever you want to call it. Is there a way out of this? Because there are some deadlines looming out there, and they're not too far away. There's got to be something done about the LIP program, Low Income Pool. We'll talk about that, which funds indigent care in a lot of hospitals in the state. And that contract with the state ends, I think, in June. And there's got to be a budget to run state government beginning in July. But we've got this impasse. Is there a way out?
Right. Well, it's a little bit different than a lot of the times when you have these sorts of impasses, because it's not just an issue of numbers. If it was, you can kind of split the baby, so to speak, and find midway points on some of these numbers. The problem is there is this issue of the low-income pool, which is about $2.2 billion a year for hospitals. And there's also this issue of Medicaid expansion. The Senate wants to do what they will call an alternative to Medicaid expansion, which would use that money to buy private health insurance for lower-income Floridians. And so it is not just an issue of fixing the budget, it's this deeper philosophical issue of, do you expand Medicaid or not? And the Senate has for a couple of years wanted to expand Medicaid, but they have not pushed the issue as far as they have this year. Ultimately, I don't know that the House is going to move off of that opposition to Medicaid expansion, but they may have to try to come up with some sort of a hybrid program or something so that the Senate can save a little bit of face in whatever deal they finally do.
They're under pressure now. The pressure has increased because of the LIP funding. Mm-hmm. So they got the one-year extension on the LIP last year, and it expires June 30th, as you said, so it goes away. This is the money for the hospitals. So they've got increased pressure. The Senate, part of why they have dug in is because the federal government has indicated that the two programs are linked.
So the feds have basically linked them, right? They're saying whether you want to de-link them or not, and we think that they are linked, right? We're going to link them.
One of the main drivers of LIP and the uncompensated care, as they call it, that it covers, are people who are uninsured showing up to hospitals. And so the federal government's stance is, if you had more people that had insurance through the Senate's, what they call their FIX program, their Medicaid expansion alternative, then you wouldn't have to have so much money in LIP. And the federal government has also indicated that they're not going to spend as much on LIP if there's this population of Medicaid expansion patients who could be covered but aren't. And so that whole complicated matrix is kind of coming into, how much is the federal government going to give Florida? And under federal law, the federal government's not supposed to answer that before July 1st. Well, the state has to have a budget by July 1st. And so there's an interplay here that kind of pushes when they can take action further and further back. And I think that the legislature just wants a ballpark number from the federal government to try and figure all this out. And then they can maybe come up with some sort of an overarching compromise based on that ballpark number.
Well, one thing that both the House and the Senate agree on is they want the LIP money, or as much LIP money as they can get. So if the feds would give them a number, even a number, maybe not all the details, that they could then back into those details later, I think that would clear up a lot of the anxiety that's out there right now. it still doesn't solve the Medicaid expansion issue. But if all of a sudden the feds toss a bunch of money down here for LIP, it eases that pressure. Would ease that pressure a little bit. The question is though, when the feds are going to do it, and if they're going to do it. The feds, the lobbyists, healthcare lobbyists, seem to think even if the feds approve an extension of LIP, that there's going to be a significant cut in that amount of money that the state has been relying on. So, there's all these sort of unknown, these variables that are unknown at this point. But even if they could get a ballpark, big picture number on that, it would help ease the pressure, and maybe that would help get them out of the ditch a little bit in these negotiations.
But one question is, how friendly is the federal government going to be towards us, especially considering that the governor sued them over this? I mean, I don't know, I'm not a lawyer, but anytime I've heard about when you're in negotiations with someone and then you sue them, doesn't that usually, I've never heard that helps the negotiations.
Well, part of the difficulty for all of us, I think, in the Capitol to understand really what's going on, both from a reporter standpoint, and I also think from the lobbyist standpoint too, and probably a lot of legislators, is that we are not involved in those discussions with the federal government. So we don't really know what the interplay is. There's so much posturing that's been going on over the past several weeks in the Capitol. There's been bombs being thrown back and forth, but we don't really know. This LIP program is extraordinarily complicated. It is not a simple thing. And so without knowing all the details of those discussions, it makes it a little bit hard to know whether there is an end game here in sight or could be an end game.